Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I am Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Join me on the first and third Thursdays on the show, where I have experts from around the country teaching you cutting-edge therapies on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. And please like and subscribe to my channel, Dr. Diane Hayden. I am excited today to have with me a special guest, Dr. Tanvi Gandhi. She is a naturopathic physician, certified integrative psychiatry provider, and licensed acupuncturist in both Connecticut and New York. She has a background in microbiology, immunology, and genetics from UCLA, and research experience at the National Institutes of Health. Dr. Tanvi blends deep scientific knowledge with holistic wisdom. She's the founder of her practice, Shiva Shakti Acupuncture and Ayurveda in Stamford, Connecticut, which is a healing space rooted in both ancient traditions and modern integrative medicine. Dr. Tanvi sees herself as a bridge holding space for your story to unfold while offering guidance and support on your path to healing. Whether in one-on-one sessions or group facilitations, her goal is always to empower and educate her patients with tools for self-awareness, self-healing, and deep inner restoration. So welcome, Dr. Tanvi. How are you today?
I'm doing really well. Thank you so much for inviting me in your show.
Of course, yeah. It's great to meet you and connect and everything. And I usually like to start these out for my listeners by just getting some insight into your journey, like your background, first of all, I have to say, naturopathic medicine and integrative psychiatry, like one is enough. You blend both, which is amazing, and acupuncture and all the things that you do. But what kind of motivated you to go down this whole path of natural healing, in these disciplines? Was there any kind of pivotal experience or something that happened in your life?
Yeah, so I graduated from UCLA, I did NIH, and I'd already going into med school, so I'd already had started in California, so that's where I grew up. And then while I was in medical school, I knew that I needed to be doing something more natural. I wasn't introduced to naturopathic medicine then. In California, they didn't have the school then, and then just from within or from inside, I just had this calling. And I moved to Connecticut and I started the program at UB. And through that path, I just discovered that the mind, body, and soul, like the integration of mind, body, and soul, is so important. So after I did my naturopathic medicine training and Oriental medicine training, I did a fellowship, a 2-year fellowship through Integrative Psychiatry Institute. And I work at a mental health hospital, and I also have private practice, but mental health is like core of my work. But to help the mind, to help the body too, which is kind of a core principle in naturopathic medicine. So I was able to integrate both together.
I think that's amazing because there are so many things related to health conditions, whether it's a chronic health condition or it might be a cancer diagnosis or anything like stress related, that kind of thing. It really, you could give the patient all this information, right? Like all this education, and here's what you need to eat, or if you need to exercise or supplements you need to take or whatever. But a lot of times it really comes down to what's up here, right? Like their thought processes, their mindset, that kind of thing. So I think with you, the background that you have is really unique. And also it's perfect for, I think, just getting better outcomes for your patients, just having that insight and being able to help them from that standpoint.
Yeah, absolutely. And I feel like it also makes it the accessibility and be able to reach, um, you know, all types of patients. And I specifically enjoy working with adolescents and young adults. And I feel like shaping or helping them be introduced to natural modalities while they are on their journey, specifically in mental health, feel like it can really help them through rest of their life. And I feel like that's been a biggest inspiration. And I've written an article when I was a teen, I think when I was 14 or 15, I wrote about mental health among my peers. And I was wondering, I was like, was I already thinking then? I can't recall exactly, but it was so specific that I wrote about substance abuse in teens of my peers. And I'm not sure how, I can't really remember how I got inspired, but it must be what I was seeing. And maybe that was how I was integrating and reflecting. And so now that I work with teens and young adults, it just feels like that was already a passion for me, but it kind of came together in a way that I wouldn't have planned for, because I didn't really plan it like that, but it just unfolded. And I'm really grateful.
Yeah, that's amazing. So you do a lot of things in your practice. Some of the things that stood out are obviously acupuncture, Ayurveda. How do you combine that or work that into all the things that you do in your private practice to provide really comprehensive care for your patients?
Yeah, I try to, and it's a really important philosophy and principle in naturopathic medicine is you meet the person where they are, really work with we use the word vital force or like their own sense of where they are in their healing journey. And I choose the modalities just based on where they're at. So, I mean, acupuncture really works with such a wide range of conditions, and a lot of patients I see definitely I incorporate acupuncture, but I also work with patients who acupuncture may not be where they can fully receive, whether they're not, whether it's uncomfortable or for various reasons. So I also incorporate Marma, which is Ayurvedic, gentle, hands-on technique, which again is very similar to acupuncture, but it's not. It's without needles, and it's same idea. It's opening the meridians and channels, but in a different way, in gentle way. So even more gentle than acupuncture. So I just base the medicine based on where the person is, and then decide, and I think that's why treating the person and not just the disease or what's labeled, like really understanding the individual constitution and helping balance and find the balance of elements within, which is again the training in Oriental medicine, which is about we have a balance. We're trying to balance the elements within, and same thing follows in Ayurveda. It's about internal balance and then how that manifests in illness, but you're trying to work with a constitution because two people with the same condition would be treating it differently.
Yeah, for sure. Let's maybe we can back up a little bit, because as you were talking, I was thinking to myself, I bet there's people listening to this who might not even have heard of the term Ayurveda and may not even know what that is. And it's interesting because my first thought was you're talking related to touch, and I was thinking like related to maybe foods or supplements or things based on, so let's explain what that is, and then I think that'll make it more clear for people.
Yeah, absolutely. I know. Ayurveda is ancient Indian system of medicine. It is very parallel to Oriental medicine. I mean, the East Asian medicine or Oriental medicine kind of originated in the regions and then kind of expanded outward. So it's the word Ayurveda means like the vitality of life or science of life, and you understand the person's constitution. That's like the very foundational of it. Same thing in acupuncture. We're trying to understand the person's constitution. And like you were mentioning, the doshas is what the word we use in terms of balancing. And we're trying to balance the doshas, which is the internal elements, fire, water, air, earth, space, and their foods. That help balance that. The seasons, the changes in season, and how we can be in tune with season is like another way, or like this most important groundwork both in Oriental medicine and Ayurveda. And Marma is like hands-on stimulation of those points on specific channels. The word is nadis in Ayurveda and meridians in like Oriental medicine. So hopefully that resonates.
Right, yeah, and I think it's seasonal. It's very related to seasonal, but also when you use the word constitution, it's the type of, I'm going to use it very simply, like the almost the type of body a person has, right? Like,
Yeah,
are they very thin and wispy? Are they more stocky, or are they very muscular? Like, there's typically three different types, right?
yeah, yeah, kapha, vata, pitta, and
Yeah.
that is a combination of two elements within each. So that's yeah, absolutely. And then they're drawn to the certain seasons will aggravate kapha, like spring season. We're entering like a kapha season.
Right. Okay. And then like summer would be, if I remember correctly, Pitta, right? And
Yeah,
Vata is more fall or winter.
yeah,
Okay.
dry. So
Yeah.
pitta is like more heat, vata is more dry and cold, and then kapha is like damp.
Right. And
And
so the season that quote you are actually aggravates you because it's too much of the same.
exactly, yeah.
Okay.
Thank you for simplifying it. Yeah, yeah,
Yeah, well,
yeah.
it's a little complicated, but it's fascinating to me. I mean, some people might think, "Oh, I'm going into the Vata season. That means that I should be, like flourishing or whatever." But it's no, it's the opposite actually. It's too much of the same to your constitution, so you want to have things that are differently. Like maybe you want to have more hot types of foods and things like that. If you're
Exactly.
Yes, if
Yeah,
you're Vata and in the Vata season. It's so
exactly.
fascinating to me.
Yeah, absolutely. It's like, how do you balance? And that's why the opposites comes in. And we always have all the elements in, but we're like where our imbalances are. And it can change through the life cycles also, like what becomes more dominant versus others.
Right, right. Yeah, I love it. I love it. It's very fascinating. I've took a couple courses on Ayurveda and
Mm.
just learning like, oh, what should I eat at in what season, and what should I be doing maybe for exercise based on my constitution, and what kinds of maybe spiritual practices. Like it encompasses a lot. You don't have to get into all of that, but I think learning some of the simple things about the way that you are made up can help you in terms of just feeling better throughout the year. So I love all the stuff that we're talking about. We're going to go to a quick break. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll be talking more with Dr. Tanvi Gandhi. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. But before we continue, I want to make sure everyone knows how to find me. You can reach me at www.drdianehayden.com or at either of my two publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about my guest today, Dr. Tanvi Gandhi, at her website, which is www.drtanvigandhi.com. That's spelled DrTanvigandhi.com. So when we left for break, we were talking about all the fascinating things related to Ayurveda and, kind of understanding your constitution and doing things from a more seasonal perspective. I love all of that. I want to get into more about like what you do specifically in your practice. What are some of the common challenges your patients face? Like what types of patients are drawn to you? And how do you use this holistic approach to address all their needs?
Yeah, I would say my practice is focused on mental health. And like I was mentioning earlier, the body and mind are connected, but a lot of my patients is anxiety, depression, other conditions in mental health, and they're already probably seeing therapists and psychiatrists. So I'm providing more of an integrative approach to look at, understand their anxiety more, like what are the root causes of it, what we can do to balance the constitution. A lot of times I'm also helping with managing the some of the side effects of the medications. So it's yeah, it's various conditions in mental health. I also work in within women's health, like balancing hormones and fertility, but that also goes back to like the mind body connection, because the whole endocrine system and nervous system are so integrally connected. We call it like the HPA axis. So I would say that's also a big part of my work. And I also do group facilitations, like hold community events where I work in a group, like hold ceremony, whether it's a tea ceremony, or do some writing and journaling, which is more of based on storytelling approach in narrative medicine, like expressing stories, but in creating a safe container for that. And I do that seasonally as well, because every season kind of brings forth, the expression of ourselves. So yeah, I do both one-on-one and group stuff, and just I guess I bring on the tools and meet the person where they are, which is so important. And understanding like medicine from, the having a foundation, strong foundation in naturopathic medicine, understanding Oriental and Ayurvedic medicine, it really helps me just approach the individual or work with the patient in a way to help balance their mind, body, and soul. And all the trainings that I've done after, like the integrative psychiatry, just help me understand like how, because a lot of times patients are already doing a lot of other things. So how do we integrate it, and how we make it that it's a safe experience, because we have to be mindful of herb interaction with drugs, and the constitution needs to be balanced because it can be aggravated. So it's like really fine tuning at that point and figuring out. And it's just like the connection, creating that rapport with the patient. And I think the safety is the first thing when you do mental health work, like creating safe space for patients to express themselves. And it's an ongoing journey. It's not just like fixing, it's like really understanding the patient's journey and their stories and facilitate. And I like the word facilitation, because I'm not trying to fix or I'm not fixing, I'm not even the healing process is happening within the person, but it's more like holding that space and safe container. And that's, I feel like, a really important part of my practice, and just creating those spaces even beyond my private practice.
Yeah, and especially when working with patients in terms of things like anxiety or depression, like that obviously you want to create a safe space for any patient, right? No matter what they're coming to see you for. But I feel like that's another layer, right? Of having to be very tuned in to what it is they're feeling and all of that. And it's so interesting. I was literally just talking to another naturopathic physician about they work with patients with anxiety as well. And one of the things she was mentioning to me was what an impact food has on that. And I was like, wait, really? I mean, you're telling me that what I eat can contribute to or reduce my anxiety. That like blew me away, because I actually never heard that before. I mean, I know there's a lot of connection we're finding out between the gut brain and all of that, but I didn't necessarily take it to the next step to understand that a particular food can actually exacerbate someone's anxiety or reduce it. Do you find that?
Absolutely. Yeah. Like the food is medicine, and really like again, fine tuning that is so important. And that goes back to constitution too. Like if you're really addressing the constitution, then the food is an important aspect of that. Like in the imbalances within, whether it's not enough nourishment, or is it, certain foods that someone's sensitive to? And then the whole gut brain axis is based on microbiome. I mean, what bacteria is in our gut based on that, we're going to be absorbing. It's not just eating but nourishing, but also absorption and then elimination of toxins. So I would say the food is very central and really important part. We have to be mindful with mental health and discussing about food as well, because a lot of times association with food or relationship with food is also out of balance. So I think just at times, I mean, and it's the most important thing, but it's like when there sometimes can be a timing when it needs to be addressed. And if someone's so acute, I think the first focus is to help them feel safe and grounded, and then work through the layers. Because I also work with trauma and PTSD, and that's really the body copes in trauma with dissociation, and then we're working on helping integration. I mean, I'm working with patients already seeing psychiatrists and therapists, and so when I come in, it's more about helping them feel safe, and then slowly the layers build upon, the relationship with food, and then eating healthy food. So, yeah, I think again, it's like I would say it's so important to kind of understand where the person is, and I would say like the safety is the key, and then a lot of layers built upon that. And absolutely, food is really important. And there's more and more understanding, even in conventional psychiatry, on like how the gut is impacting, because the serotonin, dopamine, all the neurotransmitters synthesized in the gut, transported to the brain, and so directly impacts the mood.
Yeah. And of course, this has got to be highly individualized, but are there certain foods that you think trigger anxiety or depression that's sort of universal across the board with maybe the majority of your patients, or not so much, it's really just an individual thing, person by person?
I mean, if you make a general statement, anything that is more inflammatory, because depression is biological inflammation, and anxiety too. So there's an inflammation in this system. I mean, what is the root of it is something we have to discover. But yeah, I mean, the sugars can be inflammatory.
Right.
Substances like alcohol relates to breakdown of the sugar, and that affects the microbiome too. Sometimes, and when you're put on antibiotics, after that, the gut has to kind of recover. So it's really important that you're eating certain types of food, like fermented foods, nourishing with probiotics to kind of heal the gut. So it is, I would say, very individualized, but if you're sensitive to dairy and then you're eating dairy, then that's creating so anything that causing inflammation, and pretty much a lot of stuff can cause inflammation, but again, that can be different from person to person. Some people can just, I mean, genetically can digest dairy and gluten, where some can't. And then that goes back to kapha and vata and pitta, or all the 5 elements that we were talking about. So yeah, I would say I don't know if I kind of didn't give you a clear answer, but it's just so individualized.
No, but like you said, I mean, I was expecting that you were going to say it is very individualized. But I think what everyone should be thinking about is just what are foods that are going to cause me inflammation. Pretty much sugar, gluten, those are things that it's almost across the board nowadays. But
Yeah.
just things for people to think about in general, like, okay, this is probably something I should stay away from, no matter what my individual constitution might be. And you said something that I just want to go back to for a second, because I've never heard this before. Depression is biological inflammation, or related to biological inflammation.
Yeah, I mean, so there are different reasons why you can have depression. I mean, there's something that is situational, obviously. There's genetic, but we use the word, yeah, there's like a certain factors that a person can be susceptible, and whether it's hormones, I mean, that's like one of the clear ones, stress hormones, just reproductive hormones. So it's like there's a biological, like a physiological response that your body has, and that can make you more susceptible to depression or anxiety. And a lot of time depression and anxiety are present at the same time. It's just which direction you're going.
Right, right. So you also do something called mindful alchemy in your practice. Can you just talk a little bit about what that is?
Yeah, and I just, the term just naturally came to me. So I do a lot of mindfulness groups, whether it's meditation, and like I was sharing, like sound baths, journaling, storytelling. And I like the term alchemy because it kind of, it's like the transforming from one thing to other or transforming from like nothing to something, but it's
Mhm.
more like in the process of healing and healing journey, the illness itself or the suffering itself sometimes can unfold in a way that it's kind of helping you to take from point A to point B, but it's hard to see when you're in the, sorry, when you're in the midst of it. So alchemy is just that process of maybe stepping back and looking at that, kind of looking at the process of transformation. And I'm recording right now for the courses. So I'm trying to create like a virtual course as well. But right now I teach that in like in one-on-one and also in group settings. And a lot of times it's like after we do a tea ceremony or after we do a sound bath, it's like what is unfolding for each person. And that's like alchemy or the process that they're going through. And I can also call it as a post-traumatic growth. That's the word we use, where like your nervous system or your brain is able to kind of see the story of the trauma or suffering or even the illness, and kind of you give it a meaning to it, but that helps you to kind of move to the next level. And it's the integration of the mind, body, and spirit. And that's why I use the word mindful alchemy.
I love
Or
that.
yeah.
Yeah, yeah. It's kind of all maybe stepping out a little bit and looking at whatever the situation might be from a more objective viewpoint.
Yeah, exactly. Yeah, sometimes the subjective, yeah, it's exactly subjective and objective. And I would say like narrative medicine or my training in that, which I didn't get to speak too much about it, but Columbia University is the only university that offers a program, and it's for healthcare providers, and they have other programs too. But that the specific one that I did my training in is about helping patients facilitate the storytelling. And a lot of times it's the process. It's not about I mean, the content is important, but what the process itself does. And sometimes we just read poetry and poems and then we kind of just talk about it. And I really like that. It it's very subjective in a way, but it can also be very objective. And when we witness other stories, there's a lot of healing that happens even in the circle. And in psychology, we use the word co-regulation. It's like we're helping, and that's community building. And I feel like that's another way where I think it makes the medicine more accessible. And also, if someone is not able to, see me as a one-on-one for various reasons, they're able to access some of those practices. And that's why I wanted to create a virtual course to make it just accessible of something they can do on their own.
That's awesome. Yeah. So obviously people can see you individually and they can see you in these group type settings too.
Yeah, yeah.
Yeah, I love that. Um, Narrative medicine. I don't think I've ever heard that term before either. I'm learning a lot on this one, which is awesome. Yeah, I just love it because, it's all stories that we tell ourselves sometimes, right? So it's maybe just, being in a group and having the ability to kind of step outside and look at it more objectively. So I love what we're talking about. We're going to get into a lot more. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. We're going to take a quick break. When we come back, we'll be talking more with Dr. Tanvi Gandhi. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden, and I am talking today with Dr. Tanvi Gandhi. You can learn more about her at her website, which is www.drtanvigandhi.com, and that is spelled DrTanvigandhi.com. So one of the things we were just briefly talking about before we went to break was a modality called narrative medicine that you've learned. I was saying to you, like, I've never heard of that before. So it's really kind of shaped your approach to patient care. And I think, probably even made you more able to understand and support the patients that come to you. So let's just talk a little bit more about that. I think my listeners will be very curious, like a little more explanation of what that is and what would someone experience when they're working with you in this modality.
Yeah, definitely. So narrative medicine, I mean, it is an emerging field, and that's why we're still not hearing it a lot. But Columbia University is one of the only university that offers that program. And it's the process of storytelling is very ancient. It goes back to like it's about also finding the meaning through the stories, but also through our stories, we're also connected to each other. So, narrative medicine helps the creative expression of the story, whether it's through writing, poetry, art or dance is also part of narrative medicine. You can narrate your story through an artistic process, and a lot of times it's about witnessing stories. So whether it's reading something, and you're reading not just for the reading, but it's like you're trying to kind of step back and understand like how it relates to you or what feelings or sensations it invokes. Also, a piece of art, when you go to look at a piece of art, you kind of relating. So that relatability, whether it's subjective or objective, is like I would say a key in narrative medicine. And uh, it can be, this is something I do one-on-one or in the group. It's really interesting, like how, again, it's like really allows the process of healing, the individual healing journey, and not just like focusing on illness, because it's about the story. And whether the story changes, maybe the story is not 100% factual, but it's more than even the content of the story, because that can happen in trauma where, the memories can be impacted because of the trauma coping. So it's really more about understanding that process. And that process is really facilitated through the space holding, which is what I was mentioning earlier. And in narrative medicine, it's really important, because then it's very empowering on the patient end. It's very patient centric. Of course, it's also humanizes the process of medicine. And it also is for practitioners, like in terms of like helps the empathy and compassion, and then witnessing. Because a lot of times, we're just you can get really the busyness of the practice, or like there's a burnout. So this really offers that creativity. And for me personally, the creative process is really important. I do a lot of work with sound and music, and I really feel like facilitating that in terms of medicine is just really amazing. So I'm really grateful to have opportunity to do the program. I don't really know if many naturopaths know about it. It's also just, it's not just most commonly, again, it's not as popular, but I know that there's it has a lot of potential, and I'm really excited or passionate to bring it to different communities.
Yeah, I think it's beautiful. I mean, and the fact that it's not just writing, it's art, it's dance, it's music, it's all of, I mean, we know all of those things help, from whether it's a perspective of helping from a mental health perspective, or I believe they help with any kind of chronic disease, stress reduction, all of that. Yeah. Yeah.
Yeah, definitely. Art is medicine, music is medicine. It's just like giving it even more relation, I think is really, really empowering.
Right. Right. And it's interesting when we think about the stories that we write about or tell ourselves or whatever. I mean, I've had situations in my life where I've kept a journal or I've written a letter to myself or whatever, and I've gone back to it maybe years later, and I've looked at it like, I don't remember it happening that way. Like I had created almost a different scenario in my mind of how something had happened as the years progressed, right? So it's like, what really happened? Like, it, did it happen this way or didn't it? It's fascinating how your mind works.
The mind is really, it's always like it makes it so you can get through the experience. And then, when you go back, maybe there's obviously the perspective have shifted because you're out of it. And
Right.
that's why like it's very subjective, and then it can be objective too. And we use that languaging a lot, definitely in narrative medicine.
Right. Right. So, Let's talk a little bit about what you do with integrative psychiatry. What advantages would you say that has over traditional psychiatric methods, particularly when it's supporting the overall health of your patients?
Yeah, so how I would say is it just helps to look at the person beyond the illness, and that's why like it's more of understanding if someone with anxiety, it's like what is causing it? Because they may be treated with the same psychiatric meds, two people, but maybe the root cause is different. So I think the integrative psychiatry just allows that deeper understanding of the illness or the cause of the illness, which is really the foundation of naturopathic medicine. Uh, but at the same time, I think in traditional or conventional psychiatry, I feel like there is just more opening and understanding of mental illnesses. And I feel and most of my cohort were psychiatrists and therapists. I mean, I don't actually know if there were any naturopaths doing when I was doing the fellowship. So it was really nice to see that there's this overall opening in the field, and it doesn't have to be, it's like we have to find what's the best thing for the patient. So medication are needed, something's acute, and medications are important. But at the same time, what other things can be done to make it a more, and that's why it's truly an integrative approach. Um, and, it's like finding the right balance of that between medication therapy and the tools that we use, like allowing understanding of the nervous system regulation, which is, the vagal toning or polyvagal theory. That's something, it's the science, we're understanding it more, like how the mind and body are integrally connected. There's cellular memory. The body has to be understood as well as the mind. And I feel like the integrated psychiatry allows the true integration of mind body, and also true integration of the different ways that can be come together, and providing a safe experience for the patient, and just working with again where they are at, and really understanding the root causes and susceptibilities and how it can be shifted. So I feel like it's really where everything can come together, and it just felt like a natural path for me. Again, I hadn't planned it. My friend who is a psychiatrist in Michigan, he just recommended, he's like, you got to do this. And initially I was like, to me, it was like, I already know most of it, but I knew that it was going to really professionally shift because it was really nice to be in the cohort where most of them were psychiatrists. So I was able to really understand like that's point of view, which is really important to understand how the, strong understanding of how pharmaceuticals works, the side effects, different conditions, but also like how it's understood in the conventional, like understanding the DSM-5 manual, which is like a textbook for psychiatry. So I think I'm just grateful that I was able to get that after my naturopathic medical training.
Yeah, and so I'm sure there are, we have a big following of natural medicine practitioners and different types of functional medicine practitioners who might be listening to this. I'm wondering what guidance you would offer them if healthcare professionals or students are interested in combining naturopathic medicine with mental health care for this more holistic approach.
Yeah, definitely. I mean, I do think the fellowship really helped. I know there may be some residencies too, and there's just more. I feel like there is even more discussion and talk about psychiatric psychiatry and naturopathic medicine. And I feel like when I just started the fellowship is when I was just hearing about it more naturally, and it kind of just came to me and I went for it. So and I think it's just important because if you're treating in a holistic or naturopathic way, just we're gonna be always treating the body and the mind and the body. And I feel like that relationship, and as I was mentioning, the HV axis, or even the polyvagal theory, which talks about the vagus nerve, it's just like it's central to so many, like the systems within the medicine, and also so many different ways of like how to help with the imbalance. So I think there are several programs now when I did, I just knew about the program that I did, which was based in Colorado, but I was able to do it virtually. But I know like in naturopathic medicine, there's a Psych ANP, which is I'm a member of. Amazing, and they have like great fellowship and residencies as well. And yeah, I mean, I think sometimes like finding a mentor, I was really grateful that I had some really great mentors. One of them specifically uh, who's really incorporating spirituality in mental health. So it really helped me because it was just helpful for me to that, oh, it's almost like finding something more similar and then trying to understand where my path is. So I'm just grateful that I was able to find that. But it's still, like I said, it's just something that is emerging. So I think we're going to have more and more awareness of it. And there's so many different paths too. So it's like what path makes sense to each practitioner can be different.
Yeah, yeah. No, I'm in total agreement. I think it's a great combination. It makes, like I said, I think when we first started the show, I was saying, it's so interrelated, like whether you're treating the body, it's related to the mind, you're treating the mind, it's related to the body. I mean, everything is all interrelated. And if you're really talking about doing a holistic, like looking at the whole body, whole mind, all of that approach, you really need to combine these two things together. So I bet there are a lot of people who'll be interested in learning more about that. So this has been fascinating. We're going to take a quick break. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll be talking more with Dr. Tanvi Gandhi. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at my website, which is www.drdianehayden.com. And I'm talking today with Dr. Tanvi Gandhi, and you can learn more about her at www.drtanvigandhi.com. That's spelled DRTANVIGANDHI.com. So I know you do a lot of collaboration and a lot of, community work and all that kind of thing. I wanted to just touch on that in our last segment here. Maybe just give us like a few examples. How do you collaborate with other healthcare professionals so you can ensure coordinated and patient-centered care? Like a lot of times I think in traditional medicine, especially if somebody has a cancer diagnosis or a more chronic condition, they've got 5 different doctors and no one is talking to anyone. And it's crazy. including like the pharmacist. So obviously you're working, to make sure that you work with other healthcare professionals alongside with the patient that you have.
Yeah, absolutely. A lot of them, a lot of times it's referrals from other doctors. So whether it's a psychiatrist or an internal medicine physician, um, and also I also refer the patients out. So it's just depending on, if it's what does the patient need, what is the patient need is what I focus on. I also do so. In terms of cancer care, I have done some additional, that was an acupuncture, like specific integrative approach to oncology. And Thrive is a local collaborative care center. I don't know if you've heard of that for cancer care in Trumbull. And I've I've done some of the storytelling groups with those patients, but they are getting the care from the nurse, from their doctor, and they're doing other services there, which is really nice to be part of that, like an integrated approach where they're kind of connected to the center and they're getting all different services there. So something like that it's not always in all different settings, but I'm glad I'm able to do that specifically for cancer because it's so important. Mm-hmm. And I run local groups in Connecticut and also in New York City in Brooklyn. So just it reaches out to different communities. The group that I lead in Connecticut is in Greenwich, and the other one that I lead in New York is in Brooklyn. So it just makes it accessible to, it's interesting. It's like different population that comes through the group. And I think it also helps build community. And even if they're not necessarily going to see me as a provider, at least it introduces them to form of medicine, understanding about themselves, connection to the season. So a lot of it is patient education is equally important, whether it's like I'm collaborating with other doctors or whether I'm doing the community work. And I've also done like I have taught other healthcare practitioners during COVID pandemic. I was part of the Graduate Institute program where we're teaching nurses and I think PA and other healthcare providers on just understanding like more of an integrated approach to care. So I feel like it can, yeah, like make accessibility is so important. And I think if patients have resources that can be, centralized or they can receive in so many ways, it can just improve their healthcare and just their just overall makes it a more pleasant experience because a lot of times it's frustrating, like you were mentioning.
Yeah, for sure. I didn't know you worked with the Graduate Institute. Oh my gosh, I go way back with
Oh,
them. Yeah,
oh, that's so nice.
I've taught there myself.
Oh my God, really?
Yeah, I was really good friends with Bud Stone. Like he's way back, and
Oh,
yeah, they advertised for many years and wrote articles and all kinds of
oh,
good
that's
stuff.
so cool. Dr. Artemis Morris, she's the one who connected
Yep, I
me
love
with
her.
that. And this was around COVID. And I did a lot of like talking about narrative medicine there too, and just naturopathic medicine. So it was a really nice experience. Really, I enjoyed working with the cohorts then. Yeah.
Yeah, that's so great. That's so great. So, one of the other things I want to ask you is how your integrative practices help not only reduce health disparities, but you also partner with diverse communities to provide comprehensive and culturally sensitive care. Can you just tell us a little bit about that?
Yeah, I think, and that's where I think the storytelling and both integrative psychiatry approach comes in. Understanding of like, when we're talking about food or different things that can help, but at the same time, understanding like if the accessibility is an issue, if helping people even connect to resources like so foundational. So understanding when I'm working with communities, and I did my graduate schooling in Bridgeport, and we had a lot of community clinics that I attended, and it's really important. It's like you have to learn to work with what you have and also provide those resources to the patients. So I think making it accessible and realistic, again, whichever community I'm working with, and understanding like what, we're treating the root cause. The root cause is individual focus, but also like we can go into like what other issues are there, whether it's like just in general access, we're talking about like generational trauma, we're talking about like educational resources. So I think it can be like it's hard to simplify it in words if that makes sense, but it just having an understanding of what we're working with, especially when I'm seeing a patient or working in a community spaces, having that sensitivity and understanding and holding space for that, because a lot of times it's just really just truly just holding space. And I feel like we didn't touch upon homeopathic medicine, and I don't want to go too much into it, but it's like it's another way where medicine is so much accessible because it's affordable and you can treat all the conditions with homeopathic medicine. So some of the community clinics that I did were very much focused on that. And there's some international clinics and things that we did when I was in school. So, just finding resources that's going to be more practical in those settings.
Yeah, it's a challenge, right? Like because a lot of integrative functional naturopathic medicine is very expensive. A lot of providers don't take insurance, and it's the challenge of having to find something that you can not only, educate the person about, but also you could do all this education, but at the end of the day, if they can't afford it, what good is all that, right? Like, how do they get that care? So I'm glad you mentioned homeopathic medicine because that's exactly an avenue right there for a lot of people.
Yeah, absolutely. It makes it very accessible and affordable. And even some of the simple things, like some of the methods that I learned in integrative psychiatry is accessible. That's why I think education is so important. And of course, I want to see and work with patients one-on-one, but I know that education can really help spread the word.
Yeah, for sure, for sure. So the best way for people to reach out, learn more about you, obviously they can go to your website, drtanvigandhi.com. Any other contact information that you want to give or the best way for people to reach you?
I think the website is really accessible and it also
Okay.
has a link to send me an email. So I would say that's the best way to reach me. And I think it has my email, but I'm happy to provide my email is Dr. Tanvi Gandhi, same thing at gmail.com. So if anyone wants to write a question or feedback or anything, I'm uh, very responsive over emails. And like I said, my website is really, I've tried to make it very accessible. So
Yeah, no, it's beautiful. And you're in Stamford, Connecticut, but you also do virtual things too.
yeah, absolutely. Yeah. And then, yeah, I've licensure in both states. My private practice is in Connecticut, but I do go into New York a lot. Yeah.
Right. And I love the fact that you're doing all the group work as well. Like that's, I think, really accessible for people as well. So
Thank you. Yeah, I
that's
really
good.
enjoy it. I feel like that is so powerful when people can gather together. It's so important for individual and collective well-being.
I love it. Well, I have learned a ton. I mean, just narrative medicine. Who even knew what that was? Now we know. Thank you so much. I want to thank you for being on the show. You're a wealth of information. I hope people will reach out to you, and I just love what you're doing.
Thank you so much. I'm so grateful to be part of the show, and I'm looking forward to hearing more.
Awesome, awesome. And I want to thank all of you, my listeners, for tuning in to the Dr. Diane Show. Please join me the first and third Thursdays at 11 a.m. Eastern and 8 a.m. Pacific. And I will be back here next time. Please like and subscribe to my channel, Dr. Diane Hayden. Have a great night.